David took you out for some food yesterday?
You spoiled me yesterday, yeah. Well, he didn't eat much. He was, I don't know if he had a big lunch or not, but he was being very, very good.
I look after the temple, Dave. That's the way it is.
The body is a temple.
Turn your head to the right.
I wanted to talk to you about this left side where I bought a comb just to show you where I had in mind. Like I said to you, I don't want to lower it.
No, we're not there. We're re-densifying all of this.
Yeah. What do you think my chances are with my hair sort of characteristics?
Well, let's see. Once I take out the first set of grafts, I remember I test the first 50 or so, but as long as those first 50 or so grafts are perfect, then there's no reason why you can't have a good outcome, eh? You've done everything right. You waited as long as possible, you know. You've been taking your medication as you should have been. You picked an okay surgeon as well. So, you know, at the end of the day, I think in the grand scheme of things, you should get a good result. Yeah, I really do. But like I said, one step at a time. Let's take the grafts out. Let's have a look at them. Let's see how your donor reacts to me harvesting it. Let's see how much you bleed. All these things obviously weigh into how good your end outcome is going to be, but there's no reason why you shouldn't. I pick my patients very selectively anyway, so you should get a good result. Look, from my perspective of things, what am I looking to do today? Like I said to you, it's all about keeping the hairline looking as natural as possible, using what's been left behind as a template and infilling the areas of particular deficit. And that is this frontal 1/3 band, worse on the left side, which is atypical, by the way.
Yeah.
Most people's right side's a little worse than their left side, so you're unique, which isn't a bad thing. You know, it's good to be unique. But first things first, let's mark off the central point of your hairline. You've got beautiful skin.
Really? Wow.
Yes, you do. You've got an interesting pattern to your hair, in that it's sort of a cow's leg, but not quite a cow's leg. You know that?
I did as a kid, yeah. It was a lick
this
there.
side here,
Yeah,
you can see it, right? So again, the key premise is to make sure that you follow the natural direction of those pre-existing hairs. If you do that, again, you're going to end up with a phenomenally nice end outcome. So this area is okay, but the primary working area should be everything sort of behind this.
If I look at it, the temples are still pretty strong, and if I can just connect them up,
yeah,
that was my game plan really. Especially this left side probably needs a bit more lowering than the right. Is that fair to say?
Lowering is a nasty word. Okay, I don't like using that word. I would say infilling. Okay, something like that. Right. So that's your outline. All right. I'm going to be infilling behind this line, further behind, and I'm also, like you said, there needs a bit more of a connection between these softer singles at the very front. So I'll be plowing a bunch of singles behind this in that transitional zone. Does that make sense to you?
That's perfect. I mean, you've drawn two lines there.
Yeah.
Obviously, you work in from the top line.
Yeah.
Everything there, that's the border, right? That's the margin.
Yeah.
What's the second line for then?
The second line tells me where your existing hairs are. Yeah.
Right, okay.
Right, that's what I've marked out there. I haven't completely marked out the apex of the hairline because these hairs are a little bit lower, but that would be unnecessarily low. Okay. These hairs on the side is where you've got still some of those native singles, and that's all I'm going to be sort of adding to, continuing to feather all the way through that frontal 1 centimeter with redensification, particularly working on this side here. So for me, your left side is definitely a little worse than your right side. They're both not great, but left side's definitely worse. See, when you bring it forward like this, you can really see those clear-cut areas of deficit around here. So coming backwards like that.
Yeah.
Forelock is reasonable, but work back to front in your situation.
It's not a good look, that, is it?
Pulling your pants down, mate.
But I think, yeah, if that joins up nicely to where my temples are, right?
Yeah.
What's your thoughts, Dave?
Yeah, well, it's amazing, isn't it? We were sitting having dinner last night, and like when you style your hair and under that nice forgiving light, it's like, you know, why does a guy need a hair transplant? It's only when you brush it back and you part it like that you can see why you're here.
Yeah.
But definitely, I agree that you don't need to lower your hairline. Actually, your hairline is actually quite low in the centre point because you've got that remnant of a widow's peak, haven't you, from probably when you were a kid?
Yeah, so I guess it's just, yeah, this little forelock, is that what you call it, this front hole?
that's your forelock.
It's just the left side, isn't it?
Left and right. Left and right. So again, right now you're doing your master sweep over, okay? This is your right side. You see how my scalp is visible there?
Yeah.
That's less than 50%. So the density is going to be slightly lighter on this side when I'm implanting, and the density is going to be a little higher on this side when I'm implanting. It will be a very marginal difference, maybe a 15% difference in terms of overall density compared to left and right in terms of implantation. Make sense?
Yeah, sounds good, yeah.
Happy?
Yeah, brilliant.
Should we get cracking?
Yeah, let's do it.
That we're working first and foremost, take some pictures, then shave all, and we'll dye the back and sides of your head. I am going to dye it just a little bit black because I want to see those particularly good hair follicles. What you have here is you have some level of diffuse thinning as well. It's not just androgenetic alopecia. And when I dye the hair, you can see the hair follicles that are more in the growth phase cycle. And those are the ones that I want to cherry pick for today's surgery, okay? The ones that are in the growth phase, they're going to grow better. The ones that are in the telogen phase, they're not going to grow as well. Plain and simple, okay? Cool? Happy?
Yeah, happy.
Let's take Ash then, cooler.
When it all grows in.
0.75 today, okay? Cool. All right, my friend. Or whatever.
You getting this, Dave?
Yeah. Are you feeling about getting your hair cut, Matt?
It used to be filled with anxiety, but I'm quite cool about it.
Ash, if you're well behaved today, I've got some gold stars there for you, mate.
Oh, thanks, right?
Yeah, it's there. That's the incentive, right? You gotta be a well behaved boy. Maybe you'll get 2.
Because you sounded down in the dumps, and then I figured out you're a United fan. Yeah. Same with me, eh? Jokes on me too.
Well, we're doing all right.
Where the island was. Yeah. You're going to take that on, right?
So where I've cut the hair to is where we're working today.
Yeah, nice one.
But you got to remember, it's a big area. So if I'm using 2,200 grafts, anything beyond that is you're not going to get density. You'll get a little bit more coverage. So it's about weighing up the 2 at all times. That left side of yours is the primary concern. You send me a picture of it.
Yeah.
So we'll fix that. Number one. That's the number one.
If they're too blonde for you to see, right?
The ones that are vellus, they will be slightly more blonde. But once it's shaved down, it's really difficult to tell the difference between the two. So it's not the color that I'm looking at, it's actually the thickness of the individual hair follicles that I'm extracting.
Oh, yeah.
It sounds crazy, right? I mean, the particulars and the nuances behind a good hair transplant procedure isn't just a simple case of pop, replace. So Dr. Cooler will start off with the anaesthetic for me, and then I'm going to come in, I'm going to start extracting your grafts, okay?
Okay.
Okay, when you start off with the anaesthetic, just give it a good hippie scrub and watch the surplus dye is kind of washed away. Whether you go to a dentist or a hair transplant, I think you deserve a little feel-good thing at the end, and not just a good hairline, but a star, 2 stars. You did it. You had a good day. Patients had a good day. They behaved themselves. They didn't bleed too much. The ones that don't behave themselves, they don't get any stars. Yeah. How would you feel? If I gave you something at the end, maybe a sticker, maybe a lollipop, and everybody said, "I'd love a sticker." That's why the stickers. Same. There's always a story behind hats and things like that as well. And put it in the office. Yeah, thanks.
You okay?
Yeah.
You're doing very well, I have to say.
Yeah,
Either you're, well, you're not squeezing the stress balls, so you're clearly not. You're clearly quite comfortable.
They make it differently in Wales, Dave.
But also what Cooler does is she presses down with her finger and
Okay.
your body can only perceive one thing at a time. So it kind
Right.
of takes away from the pain a little bit. Sometimes we flick as well.
Yeah, you can like tap as well
Yeah.
as you're injecting.
Oh,
Especially on the opposite side, it can really help. Turn your head to the other side. Behind the ears is actually the most
That's
painful. So
yeah,
you're
that's
really
probably where
well.
it's just tender, isn't it?
Yeah. You're doing really well.
It's like a rock.
Gloves on.
Isn't it? You're not even shaking.
Yeah.
Well done.
You're doing okay, my friend?
yeah, all good.
Yeah.
How many's gone in there?
You don't want to know.
You don't.
Yeah.
You get people ask that, like how many?
All the
injections?
time. How many? And I
How
just,
many injections?
so my simple answer to that question is till you can no longer feel it.
Dr Mani, my native hair,
Yes, sir.
how long, that should grow back, and I can play around with that, you see, and kind of style it like I used to have it.
Yes.
And that should be all okay, should it?
You can get some shot cloths.
Yeah.
It's the only time we recommend PRP. This is the prime example that we were discussing yesterday about the people that you're working in and around, trying to kind of improve the density to mitigate the shot cloths. He's a prime example of why someone should have PRP. So indication is really important. Not everybody should get PRP, but there are certain patients that would be better off with it to help reduce the chances of shot cloths. In fact, let's do that today. We'll do a complimentary PRP for him after I've done the incisions.
The fallout after that is kind of temporary, is it, the shot cloth?
Yeah, it's temporary. It's temporary. We're very parallel to the direction that the hairs grow out when we do our incisions. So as long as you're not cutting across the hair follicle, then you don't transect it. If you're parallel with the hair follicle, then it won't damage it, but you can traumatize adjacent hair follicles. Even the anesthetic, my friend, will traumatize your hair follicles. It's got adrenaline in, lowers the amount of blood coming to that area, which again will cause a little bit of shock loss. Some get it worse than others. Expect it to be relatively bad for you because your donor area is already a little thin. Does that make sense?
Hey, what's your view on finasteride and shot loss? Do you find that patients who are stable on finasteride seem to have less shot loss? Or?
Sometimes. So you just can't predict. Sometimes the more anesthetic that a patient requires, regardless of whether taking finasteride and minoxidil, they'll still experience shock loss. But you are right. It's less with those on finasteride.
I think so.
Good. Keep taking some deep breaths in, please, Ash. Some deep breaths in at the top. Hold it there, and then exhale for me.
Is this sharp here?
Am I meant to say yes?
Well, you were just meant to tell me if it hurts.
No. A little bit there.
Here?
Not really, no. There, a little bit.
Here?
Yeah. I've been a good boy, Manny. No caffeine. So.
Good boy.
He's on his way to some stars.
He is.
Yeah.
You are.
Perfect.
You are on your way to earning some stars.
So, Ash, out of 10, what would you rate in terms of the pain of the anaesthetic?
Oh, that's it.
2.
Wasn't bad at all, no.
Want to just stretch out or whatever. There will be natural breaks during the entire process anyway. All right, chin is like. You give me a 0.75. Beautiful. Any pain here, fella?
No.
So what was that you were just doing there?
Yeah, that's Temess.
Tumescence, yeah.
Yeah, so we just like to inflate the skin up a little bit. 2 reasons: we like the head to stick up a little bit more perpendicular, so it's easier for the extraction. And number 2, it helps with bleeding. And number 3, it makes the holes on the back of your head slightly smaller. Any pain here?
Nothing, no.
Me. Very good block, Dr. Cooler. Does it feel surreal that you're finally getting some holes cut into your head today?
18 years in the making.
Yeah, it's been a long time coming. How's the blood situation?
The blood's not too bad, to be fair with you, mate.
Not bleeding too badly.
Small grafts.
Fine hair, yeah.
Yeah, it's very consistent with the type of hair that you've got. Small grafts are nice grafts to implant. My colleagues love small grafts. Yeah, I think I worked out the angle and the depth. So like I said, the first 50 or so is just kind of getting a feel for your head.
Yeah.
Some really nice grafts here, my friend. A lot of doubles and a lot of triples.
Brilliant.
They look like they're coming out quite well.
Yeah,
Quite easily, yeah.
they are coming out really nicely. Some nice doubles and triples. Really small punch for you today.
But they are playing ball and it's not a tough
I think they're excited to see me, mate.
nice one.
18 years of patience.
So you're happy with the grafts that you've extracted so far?
So far, yeah.
Yep. And that's with a 0.75.
This is a 0.75, yeah.
Yeah.
Of course, they need to still be looked at under a microscope.
And you made that decision on the size of the punch based on the size of this hair caliper and follicles?
Yeah. Very rarely will I go away from a 0.75, just only if it's like particularly coarse hair. But then, you know, your area of deficit isn't the worst either, so it kind of goes hand in hand. Do you see what I'm saying?
Yeah, it's a
Like,
balance.
yeah, exactly. If you was completely bald in that frontal 1/3 with a donor area like yours, then perhaps you wouldn't make the best candidate. Do you see what I'm saying?
Yeah.
Whereas because you're more of a diffuse thinner in that region, you make a better candidate based off of your donor area being slightly weak.
What's the ratio of 1s, 2s, and 3s in the donor?
For him,
Yeah.
or in general?
No, for Ash.
For Ash, at the moment, I would say he's probably harboring at average 25% singles, 50% doubles, 25% triples.
Okay.
I want to try and improve that to around about 34% triples. That's the idea.
So there's going to be enough naturally occurring singles then for the immediate hair.
I hope so. I hope so.
Yeah.
See, that's a quad.
Right, you go pull the quad out then.
Yeah. And then the one right next to it is a single. So your average count comes straight back down to 2.
Yeah.
But this is what I'm saying. I expect it to be sort of 25% singles. That's another quad. Some of these graphs are absolutely 10 out of 10.
Are they?
Yeah, really. Better than I was thinking.
Awesome. When you say a 10 out of 10, just easy to get out, or?
No, it's not even easy to get out. You know, you've got a little kink to some of your graphs as well.
Right, okay.
Did you ever used to have curly hair by any chance?
Bit of a wave, but
Yeah, a bit of a wave. I mean, 1 in every 20 or 30 have a little kink to them.
So when you extract it, obviously you get a bit of fatty tissue surrounding the bulb.
Very good. Yes, you
That-
do. You
That,
do.
that helps you, does it, when you're implanting into the front?
It protects them, number one. Number two, it provides some of the grafts with energy. Because you got to remember, for 5 days, they're just sitting there feeding off their own supply. So this whole, remember once, I don't know if you know, but once upon a time, there was a thought that ultra skinny grafts is the way forward. But that was quickly discarded as a thought. There's just not enough tissue on them to actually survive the transplant process. So it's about marrying up, having enough tissue to survive a transplant, and also making sure that there's not so much excess tissue on it that it creates unsightly scarring post-transplant. That's down to your own healing, to be fair with you as well.
Oh, is it?
So you can't always say that that's down to a hair transplant procedure. Sometimes after the procedure, patients maybe bend over a little bit and it causes the grafts to just lift out of the incision ever so slightly. When it does that, that's when you get that sort of cobblestoning type of look.
That's it, yeah. So what are you recommending when I go back to the hotel, just to sit upright for the night?
Upright, yeah, mate. It's weird, like even coughing or sneezing increases the pressure to your scalp.
Yeah.
And when it does that, inevitably it's going to cause the grafts to rise up.
How many nights would you say, just for the first 2?
3 nights.
3 nights.
Turn your head a bit more to the right, please. Just have to be super careful.
Notice you change the speed.
So I'm always, when I'm punching, I'm always feeling for a pop, a give. And sometimes when it's too slow or too fast, you don't feel that pop. So I'm always adjusting. Ash here is quite a slim chap. Because he's slim, there's less surrounding tissue that anchors the graft.
Right.
And as my colleague rightly pointed out, he's got quite a pronounced muscle up here. And so when you're cutting through the tissue, sometimes you just go at slightly higher speeds to be able to get through.
Like you say, the more coarse hairs are at the back, so when you move to the side, you get the finer. I guess that's where you're going for the feathered approach in the front, right? Or do you use the back one?
So with you, you actually want slightly coarser hairs to get you the density.
Yeah.
And I would say that with you, there is no real change or difference.
Generally, the sides are lower density, though, aren't they, in general?
You mean there's less grafts per
Yeah.
square centimeter?
Yeah.
Yeah, that's true.
On the sides?
On
Yeah.
the sides. Training is every 30 to 40 minutes for the first 24 hours.
Right.
And then after that, it's just during the day on an hourly basis. Sometimes when patients bleed a lot more, you're really kind of anal about the 30 to 40 minutes because you don't want one big scab, you want small individual scabs.
I'm going to drive home tomorrow around 1ish.
Yeah, so hourly, you take breaks.
What are you now extracting them?
Yeah, I mean, I've been doing that around anyway, so I've made 900 or so holes.
Right, okay.
Probably pulled out around about 250, 300, something like that.
Well, I like what you said as well. I was watching one of your surgeries. You did an Insta Live and you said we keep them in the body for as long as we can.
Exactly.
Super tiny little extraction rooms, aren't they? Really tiny.
This is right now, by the end of the surgery.
And that's just within, an hour of those being extracted.
What's the range in the diameter of the drill bit you're using? This is a 0.7, did you say? 7.5?
7.5. So for ultra fine hair, you can use a 0.7. Going up to a 0.85, wouldn't go beyond a 0.85.
And I guess, again, it's all down to the skin complexity and everything else with the individual.
But everybody heals differently. Some people, it is almost impossible to see.
It is, yeah.
And on some people, even with smallest punch, you still see it.
Suppose you could just get the SMP into them, couldn't you?
No way.
No?
That's not good.
Is it not?
It doesn't. It's okay. It can be okay for a period of time. A year, 2 years, something like that. It inevitably fades. And on any scar, it doesn't take as well.
Right.
It just doesn't.
Plus,
It just smudges as well. It doesn't remain
Over
a
time,
sharp
yeah.
little dot.
I mean, ultimately, though, if I grow the donor anyway to like a grade 3, 4, you won't notice it, will you? We'll just...
Oh, mate, your length hair that you got right now, it's not going to be noticeable.
Yeah.
But if you go down to a 0.5 or something like that,
Yeah.
or a skin fade, then yeah, you will see scarring if you know what you're looking for. But most of the time, when patients go to their barber, it's always like, mate, this is the best I've ever seen. Where's he taking the grass from?
The whole point is to get it done and ultimately hope that no one knows you've had it done, right? You don't want to walk down the street and someone go, that's a good hair transplant, that. Who did it?
The best compliment after a hair transplant is people who you see now and again don't actually realise. They just compliment you because they say you're you're looking well, or if you know you're looking healthy, that's the kind of best compliment you can get.
You'll be surprised how many people you talk to who are interested in getting a hair transplant. It's like a snowball effect. You know, as soon as you've had one, you become the most popular guy in an office. Oh yeah, you had a hair transplant. Everyone's coming over, and oh, you shaved your hair. How was it? Who did you go to? What was the experience like? Blah 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 blah. And I've had that. Like patients have gone back to the office within 5 days of having it, and they've got scabs on their head. At a distance, people can't tell. It just looks like you've buzzed your hair down. But when you come close, it's like, oh, you got scabs on your head. What happened? Oh, the hair transplant. Oh, okay. Tell me more. And honestly, men become the most popular people in the office.
People, especially dudes, they'll talk not so much about it, but when someone takes a leap, you've had your hair done, then it kind of opens up the conversation, the discourse to who did it, because I need it doing really.
Your friend getting it is the best way of researching. If it looks good and they're happy with the result, then you just sort of follow their. So many people I've had over the years who've recommend personal recommendations, friends had it done.
Well, it's funny even with mine. So I was losing it early 20s. You look around at all my pals who have thick hair. They've all caught up now, all gone beyond. Gone bald.
Yeah.
So they've caught up, and it's funny. So Propecia did do its work for me. It worked out.
That's the average, roughly 2 hairs per graft. I'd expect you to be about that. 2 hairs per graft is what I'm aiming for. Steve, so far we've got 91 singles, 119 doubles, 45 triples, and 1 quadruple.
Nice. So the quadruples, obviously, they're in short supply on my donor then.
Yeah.
Yeah.
That's like hitting gold, mate.
Oh, is it right?
Oh yeah, so here all we're doing is we're just working in between those pre-existing hairs. So first pass is just to improve the density throughout. And then after we've got the initial template, see if we can work a little closer to each incision that I've created. But again, everything should be relatively parallel to the exit angle of those existing hairs. If you do that, you tend not to transect.
How often would you work through an area where you don't shave the recipient at all, or
females?
Yeah.
So very occasionally.
Okay.
We do partial shaves a lot.
Mm-hmm.
So where we shave the areas of deficit and leave everything else. I don't know, I just think it's a lot cleaner for patients to just, if you're going to do it properly. Try and get yourself the best possible result with the least amount of risk.
Sorry, I missed that. Did you mean blood supply?
You're bleeding a fair bit in the front.
Is I take it that's a good sign for the nutrients to get there, right?
Yeah, it's a double-edged sword, mate, really. It's a good thing because it means that the grafts should be well nourished. It's also a bad thing because it means that you might end up scabbing quite heavily after the procedure, which means it might take longer for you to remove the scabs. Also, it slows the process down a little bit for me surgically because I can only see when I'm wiping constantly.
Dilating with
minoxidil.
Yeah,
it normally is.
I did stop it, like I said, 3 months ago. Obviously, with the view to that having this done. I spoke to you about it,
Yeah, 3 months is more than enough, mate. Normally 2 weeks is what we recommend.
It makes a different noise to other parts of the skin, if that makes any sense.
Yeah, you can hear it, right?
Yeah.
You can feel the crunch, the difference.
Yeah.
100% agree. Does make complete sense. When Corda started working with me in September or December or whenever it was, at that time I was a little on the fence And she saw me changing my practice, where I'd say no, no, no to oral minoxidil, and then actually looking at other results, reading the papers, the studies. It's actually hugely beneficial. Yeah, here you've got heavier scarring, my friend. You can get something called minoxidil burn as well. Feel that?
Yeah.
Yeah.
Well, not feel it.
No,
hear
no,
it.
you heard that.
It
That's
feels
your
a bit,
thick fibrous
bit
tissue.
crunchy, does that? Try to testosterone to your patients at all, or
I do, yeah, I do. Yeah. But not very often.
No.
There has to be an indication for every medication. There has to be an indication for every surgery. There has to be an indication for any treatment.
Mm-hmm.
If there's no indication, then absolutely not. Because I use less adrenaline than the average surgeon as well. A lot of people like to really push the adrenaline levels.
And you don't use huge amounts of tumescence, I noticed.
Just enough.
Yeah.
What's the rationale behind that then? The overuse of adrenaline.
Some people don't like to see bleeding at all.
Right, okay.
I like to see it. It makes me feel more confident. Chin down for me.
With what Ash had in mind, then what's your view on microneedling?
Hate it. Yeah, I think when you're doing it at home, mate, in particular, people use dirty needles. They don't, sanitize properly. They go too deep. They overdo it. There's a bunch of things, man. You sit there every night, derma rolling or whatever. Like, you should, as a patient, never be drawing blood. The number of incisions I make today will probably slightly less than the number of grafts that you have, just because the extra singles that we do have, I'd like to put 2 in 1. Does that make sense?
Yeah, yeah.
So you get 2 hairs coming out of one site.
Where will you put those in behind the ones in the front then? Or is that kind of...
No, we kind of sporadically place them. So I don't want a specific area to just have doubled singles coming out. It's important that everything is sort of random.
It's a random distribution.
Yeah, always.
Yeah.
I feel like I've been treated like a king, really. I think this is... I'm impressed by it all.
Excellent.
I think, like I said to you, the conversation, you live in your own head. I just think you make it worse. Naturally, as humans, you make the event worse in your head. And it plays out in reality.
Yeah.
I was totally confident in Mani. It was my own kind of apprehension and my own battles that I've faced throughout the 18 years of deciding. So it was all on me, really.
And from the time that you booked the procedure to the time that you actually had it, did you go through a lot of nerves where you were thinking, am I doing the right thing? Should I change my mind? What was your thoughts?
He's still thinking that right now.
He is, I know.
No,
He's going to bolt it any moment.
I think a week ago, when I text Mani and I went, oh shit's getting real now.
Yeah.
That's when I had my first sort of, bit of doubt.
Wobble.
Being guided somehow to hold off for so long.
Yeah.
And little did I know that it was the right thing to do, to give yourself the best fighting chance for graft survival moving forward. And what Mani's doing today might potentially last me till I'm an old guy, or I might be back in the seat in the next 5-10 years. I don't know, but
I hope not.
yeah, well,
I think if it's taken you 18 years to get to this point, we would really hope that you wouldn't be back in the chair in 5 years.
Yeah.
But you never know how hair loss progresses.
It can sometimes pick up.
Can you see? Just turn it a little bit this way, pal. The whole thing,
Yeah.
Yeah, so you've got just point them out what they are again.
This one is a 4. You could see 1, 2, 3, 4 black
Yeah.
dots.
Yeah.
And this one 3 black dots. And 3. There's your 2. And this one is a trimmed single.
So that's your refined singles.
Nice one. Because you don't do this a lot then, Manny, do you think Ali's dicking on you in terms of speed?
Obviously.
Yeah.
They all dick on me in terms of speed.
You'll see from the video who's implanting at a much faster pace.
But also,
I'm slow. I want to stay on the job.
Good answer.
That's the thing. Never do something too quick though.
You don't want to outshine your boss, right? No, I think.
Mind you, that's a lovely technique though with the keep though, isn't it?
Yeah, it's very nice. This is why it takes a little bit longer with this forceps.
What are you guys using? A different forceps each, or do you?
So I've still got an implanting forceps, but what I do is I slide it through my keep forceps.
Right, okay.
So you're opening up the incision with the keep.
I am.
What's the benefit of the two then?
I don't know. I think that for me, I'm not as technically gifted as my techs when it comes to implanting, so I needed a method where the learning curve was less steep.
So you're implanting twos at the moment, right?
No, this is a mixture of doubles and triples.
Okay.
So I want this area to have higher density.
Yep.
You see, like this is a triple here.
Yep. Thank you. How's your legs?
Just a little bit shaky, but I think it's just I'm getting
Okay.
cold though.
Eight?
8 now, not really.
Achy? No? You okay?
Oh, good.
You feel a bit cold, you say?
Just a little bit chilly, yeah.
Yeah.
Everyone in Travelodge now, doesn't it?
Are you just there for tonight and then
Just
you
for tonight,
drive back
yeah.
tomorrow, don't you? Yeah.
I'll probably escape early morning.
Amazing. We'll
Yeah.
take some final pictures.
Yeah.
So if you would like to come take a seat on that chair there. Beautiful. Don't fall over. Remember, keep your head upright and neutral, please.
Okay.
Are you feeling okay?
All right, yeah. Just,
Yeah.
You a bit shaky or just
yeah,
a
it's
bit
a bit
cold?
shaky. I think
Right.
it's cold.
Okay, perfect.
Yeah, all good.
All good. Now you drink your water, get changed,
And then,
and then we'll go through the post-op.
Yeah.
yeah.
Okay, so you can spray the recipient area every half hour today and for the next 3 days.
Okay.
Okay, and every hour tonight.
Should I do it with my head back or?
No, head straight, just like that.
Okay, just a bit of mist on, yeah.
Yeah, well, 10 sprays.
10
Okay.
sprays, okay.
Yeah,
Every half an hour.
every half hour during the day and every hour at night.
Okay.
Just tonight.
Okay.
Okay? And then continue with your antibiotics. So this is doxycycline because you're allergic to penicillin.
Yeah.
So just once per day. You've had your tablet for today.
Okay.
So the next one tomorrow morning at 8, depending on what time you wake up. So this is travel cushion to help you sleep.
Great.
So you'll
Oh,
be
nice
sleeping-
one.
Yeah, so you'll
Yeah.
be sleeping at 45 degrees,
Okay.
45 to 90 degrees.
Yeah.
For the next 5 nights. So just put this on, put some pillows behind it, pillows to support your back.
Yeah.
And that's how you can sleep for the next couple of days.
So when you say 45 degrees, can I just kind of lie down on my back, just my head kind of up to that?
Yeah, exactly.
Yeah, so just like this. Not sitting upright like this.
No, if you can't sleep like that, then you can do like
Then I can
kind of
do just a bit
that.
of, yeah, with that
The
support.
main reason for that is to stop you bumping the grafts into anything, so
Okay.
they don't come out, because they're literally just sat in the incisions right now.
Okay.
Okay? Tomorrow, 4:30, like we said, you can take the bandage off.
Yeah.
We packed you some gauze, so you gently just dab the back, spray some saline on it, wipe it down.
Okay.
If it bleeds, hold the gauze to it for a minute, then you
Yes.
can let it go and stop. But you can leave it open after that,
Okay.
and then send us pictures of the back and the front.
Lovely.
Okay? And you continue spraying, continue taking your antibiotics until you get to day 3. On day 3, what you can do, you pack you some shampoo, just some baby shampoo, dental shampoo.
Yeah.
You do your first non-contact wash. So sit down in the tub, get a plastic jug, put a small amount of shampoo in the bottom with that, and fill the jug halfway with warm water. Gently pour that over your head, Let that sit for 3 minutes.
Okay.
Then get clean warm water and rinse that off twice. Okay? No towels, no sponges, no touching. Just let that air dry after that.
Okay.
Okay?
So just to repeat, put a bit of that on top. In
No,
what dilute
into
it?
the jug.
Into the jug.
Yeah.
And then just gently pour.
Gently pour it.
Do I need to put my head back again, or is it kind of?
I mean,
full?
well, yeah, just to not get shampoo in your eyes,
Yeah.
but like, that's it. Just try not to move it as much, but you can lean back.
Okay.
That can be very careful. If you need to do it in front of a mirror, do that.
Okay.
Okay? Repeat that again on day 4, and then on day 5, you can do a contact wash. So sit down, wet your hands, get a small amount of shampoo, lather it up, and then gently massage the recipient area. Wet that first, just pour water with the jug.
Okay.
And then gently massage in white circles. Okay?
Yeah.
Then get a jug clean water and rinse that off twice to make sure nothing's left on it. And then you just contact wash every single day until all of the scabs fall away.
Okay.
Okay? On day 6, so day 5 is the first time you do a contact wash. You'll wake up the next day and do it again on day 6.
Okay.
And before you sleep on day 6, put some aloe vera gel on the recipient area. What that does is it just softens the scabs. So when you do your next contact wash, it will help them come away quicker.
Okay.
At that point, all you do is rotate between the two. So aloe vera gel at night and then shampoo in the morning. Okay? We've also packed you these covers to put over your pillow. So once you take the bandage off, just put that over this like we did today.
Yeah.
And that's mainly to stop the bed sheets getting dirty. Okay. Do you have any questions?
No. Oh, good. Surprisingly, I feel quite good.
Good.
You seem really with it, and
I
it's,
feel okay. How's my head looking?
Amazing.
As Spencer would say, how's my head?
looks wonderful, Ash.
We've
Look
printed
amazing.
all the aftercare for you as well.
Okay.
But obviously we're creating a group chat, so if you have any questions, just ask.
I will forget most of that.
Yeah.
Of course you will.
Everyone does.
Yeah.
Everyone does.
but you'll read through it, and then you go, oh, I remember now.
Oh, so the instructions are in there too?
Yeah, yeah.
Oh,
This
good.
leaflet has everything on it.
Okay, I won't forget them.
Okay.
Can you just book an Uber for you as well?
Yes, please. That's okay.
Just which travel book?
Travelodge.
Of course. There you go. Badge of honour, mate.
Oh,
Get
cheers.
to.
Bloody hell. I'm
2 stars.
yeah.
I might even give you 3, mate. There you go. It looks better with 3 on it.
It looks like a
To travel.
or sheriff.
Then you wouldn't know to travel.
Got no idea.
You don't even know.
And also one other thing, my friend, is we have a guest book here that every patient is now signing for us.
Yeah.
It could just be a few simple words, mate. It doesn't have to be anything extensive. Write something if you'd be kind enough.
Just on top, Manny, when you need these where you put the grafts now, where it's spaced out at the front, is that because that's where my native hair was?
Yeah.
So you're working around.
I had extra grafts, so that's why I put them in that area. Originally, this morning when I drew it, I was going to put any. Got a few really nice tumblers. The Johnny Walker ones are really nice. Oh, this is a proper whiskey glass.
So
mate.
the crystal cut on it is a game changer.
This
Look
is
at
a
that.
proper whiskey glass. Nice little swizzle.
Yeah, a Friday night. It's a beaut.
I might even put my brandy in there, mate. This is sick. This is beautiful. Thank you very much, man.
No worries.
Really kind of you. Thank you.
Cheers.
Appreciate you, man.